Good evening and welcome to Face to Face. I'm Niresh Eliyatambi. The crisis continues in the health sector of our country. Just a few days ago, the GMOA, the Government Medical Officers Association, issued a dire warning that 10% of government doctors have already left the country and another 25% have got the qualifications, they've got the foreign licenses to migrate to the UK and Australia and those other greener pastures. But what would happen to our health sector, our hospitals, if more doctors leave en masse? And to discuss this, we have with us two very distinguished gentlemen, both from the medical fraternity. And to my immediate right here is Dr. Nihal Abeysinghe from the National People's Power. He is the secretary of the NPP. And over there we have Dr. Ajith Amarasinghe, chairman of the United Republic Front. Thank you very much for spending the time with us, gentlemen. Welcome to the show.
Thank you, Niresh.
So let me start with Dr. Ajith. What's going on? Are so many doctors ready to leave? Is it such a dire situation?
Yeah, it's a dire situation. Sri Lanka has been having a steady increase in numbers of doctors and consultants probably over last 30 to 40 years. And what we see now is with the current economic crisis, we see that large number of doctors and also medical consultants are leaving the country. Now if we look at the reasons behind this, there are many reasons for this. One thing is that during the past 3 years, the inflation has become so big. Even the World Bank has done a survey where they have found that household expenditure has gone up by 3 times during last 3 years, and the doctor's income has not increased. That is one reason. So when they see a way out in the developed countries where they could earn a bigger salary, they would definitely take that chance and go out. That is one reason. Secondly, most of these doctors who are migrating at the moment are young doctors. They are doctors with young children who are concerned about the future of their children. And what they see at this moment is that they see that their children they have no future in this country. So they want to ensure that the education they had, the future they had, they are going to make sure that their children too have. So therefore, due to the uncertainty of the future of their children, these doctors are leaving. And also at the moment, not only the health sector, even the education sector is in a mess. So especially in government hospitals, government schools, they don't have a proper schedule. There are exams are conducted ad hoc, and also even after coming out of school, they don't see a future in the local universities as well. So these are another reason for these doctors to migrate. So we have this problem, and actually the doctors who are intelligent enough to see that whatever proclamations are done by the government and the leaders of it, the future of the country, economy of the country is not turned around. It is in a very bad state and there's no future. In the near future, people don't see that this would turn around and have a kickstart in the economy. So whatever the propaganda is made, proclamations are made about turning around the country, doctors who have a better knowledge and understanding, they think that it is not done, and therefore they have taken this decision to leave the country.
Dr. Nihal, what are your views on this subject?
More or less the same, Niresh, that because when this crisis happened, a lot of doctors, they faced with financial issues, because now they have this the government introduced this tax new tax, because up to 6% to 36%, right? So that is basically this the tax is one of the issues that they have never faced in the past, but now they are facing. Now everybody is facing, at least in the among the who are among the doctors, right?
That's the income tax.
Income tax.
So
yes.
That's only one of the many taxes.
Yes,
You have
yes,
the VAT and
yes,
you're
other
going to
taxes
have
are there,
more
but then
taxes.
this is basically they are confronting with at the moment, and also as Ajith said that their children's education, because they are not very sure what the future would be in this country. So I mean, because they know that I mean they have had some reasonable lifestyle in the past, but they are worried about their children. So if they want to find better schooling for the children, so they are thinking, why should they stay here? I mean that's perhaps another reason that why these doctors are trying to leave the country. And also when the young doctors who pass out after the training, when they come back to the country, sometimes they are placed in the very remote stations where the facilities are very limited. Sometimes they can't practice what they have learnt during their training, so because those stations are still we need to develop those stations, so they are frustrated, right? So then when the opportunity comes, so they tend to leave, because they have either had their training in Australia or UK. Most doctors, they are postgraduate training, so they know where they know the people where they have work, so they get some connections. So when they find good opportunities, they tend to leave the country, because they think that there is this uncertainty. It is really created a situation that nobody thinks that when this can be improved, so that perhaps those are the reasons.
So it's more than just the health sector.
Yes.
It is the country as a whole, the economy, the education system, it's everything.
Yes. The doctors face all these issues.
Right. Dr. Ajith, if I could ask you, how many years does it take for a person to qualify as a doctor and then as a specialist?
Yeah. So it depends on which year you enter the university. For example, I was there in the university medical faculty for 8 years, whereas I would have come out within 5 years, because it's during our period the famous NCMC or private medical college issue arose, and there was a political calamity in the country and universities were closed for 3 years. So it took me 8 years to qualify as a doctor. Then after qualifying, it depends on how fast, how soon you would do the postgraduate exams. Minimum of 5 to 6 years, I would say. Maximum could be depending on the doctor's ability to do exams, which depends on the financial ability to sit the exam rather than earning money. So actually, to become a consultant, it would take about 5 years. In the shortest period would be at least 11 to 12 years from the point of entry into the medical school, which can be even longer, much longer than that period.
Right. So we are talking in your early 30s,
Yes.
probably. So that's quite a lot of experience, which is basically being lost to the country. And let me ask Dr. Nihal, when doctors and specialists migrate like this, are they ever likely to come back in significant numbers?
Some people really, Niresh, can find good jobs. If they find a good job, perhaps they will stay, and then they will take their families there, and then they'll start educating their children. But if they don't find a good job, perhaps they tend to come back, provided that we can improve the situations in the country. So if we can, there are now so many things are happening at this moment, and people are expecting elections I mean, in 3 months. So if something change, certainly that some doctors might come back. I mean, just like any other professionals, because if the country situation improves, so then I mean, that will definitely help them to take that decision.
Let's talk about your party's plans. Should you come to office in a general election or presidential, what are your plans regarding the health sector?
Health sector, Niresh, that we have identified few priorities, because immediately we have to rebuild the trust that we have lost. I mean, if you really go back to the history, I mean, Sri Lankan health system up to about 2010, I would say that one of the best health system in the Southeast Asia, at least in the South Asia, right? And then it deteriorated now for last 14 to 15 years, and then so because of that, now it's not easy to correct what has happened during last 15-14 years actually. So therefore that we need to bring the lost trust. I mean, we have to public trust, we have to rebuild the public trust, and then finding solution to minimize the issue that we discussed about the brain drain. And then also that ensuring access to accountable, efficient primary care service, because now 50% of public of our country, they are going to the private sector, and they are not really going to the government sector for their primary care needs, right? So if we correct it, certainly that the health will improve, public health, the health of the public will improve, and then the people will be happy to really get the services from the government health system. So that has to be corrected soon, as we I mean, if we really want to change this, the things that already happened during the last 14-15 years. Yes.
Dr. Ajith, what are your thoughts on your party's policies? Let us assume that you would be part of a government in the future.
Now, it's a very complex answer, and it would take a very long period of time to see how we would improve healthcare. But I will address the imminent, like the most important issues. Now, you were talking about the brain drain. Now, in the brain drain, the issue of brain drain, there are certain factors that are not under our control at the moment. One thing, the country is in bankruptcy. So, it would take at least 1 or 2 years for us to turn the bankruptcy, and then this brain drain is happening. So, what we have to understand is, when if you go by the statistics, we can see 10 years back we had in the government sector half of the number of doctors we have at the moment. So, what we need to do is to look at the services and relocate the services, and then through relocating of services and doctors, we have to ensure that the service is provided to the public efficiency. That is one. Because turning around the economy and making the people more prosperous and ensuring that the doctors retain in the country would take some time. Immediately what you have to do is see where the deficiencies are and have some arrangements within the healthcare system to ensure that. Then secondly, what we see is that past 20 years, the healthcare expenditure has gone up by 4-fold. 20 years back it was 161 billion per year, and it is 443 billion per year at the moment. So, when the economy shrinks, what we have to do is we have to make sure that we also ensure that when the economy shrinks, that the healthcare priorities are identified properly and the priorities are addressed properly. As Nihal said, what we think is that we should spend more in preventive healthcare services. Now, of the total health budget, we spend only 5% in preventive healthcare. And if you look at the hospital admissions and number of deaths in the hospital, two most important causes of hospital admission, one is trauma injuries, second is non-communicable diseases like diabetes, hypertension, stroke, things like that. So, when it comes to trauma, what we have to do is a really preventive type of a educational campaign, health promotion, in which Dr. Nihal Abeysinghe is expert in. So, this trauma and injuries are mainly domestic injuries. So, we have to have a proper education campaign in the within the public to ensure that it is gone down. Secondly, we feel that investing in preventive health care to ensure that the non-communicable diseases are reduced, like the diabetes mellitus and then diabetes, hypertension, stroke, ischemic heart disease, which could be done by actually educating the public about having a proper diet, exercises, things like that. So, that is most important, because it has been found in many countries investing in preventive health care is very important. Then the other problem we have
let me interrupt you there. You mentioned that only about 5% of the health budget is going into preventive health care. What would you like to see that percentage come up to?
At least 10%. Okay. 10% increase is a doubling of and also we must have more as he said, a primary health care system as well. I will come to that. Then though we say that we have a free health care system, if you look at the health care expenditure, 50% of the expenditure is coming through private funding, means like out of this private funding also 80% is out of pocket expenditure. That is the amount that you spend to channel a doctor, see a doctor, buy medicine. So, that is a large quantity of expenditure which is spent by the public through their own pocket. Now, what happened during the crisis is that the people's expenditure on food and other things have gone up. People are not taking medicines properly. People who are having hypertension, they are taking, if they should take drugs every day, they are taking every other day. So, likewise, we may not see the number of deaths going up, but it is happening in the country due to this. So, what we are planning to do is that for this amount of money that is spent out of pocket, we want to have a national health insurance system where people contribute a small amount of money. This is not for the government sector. Government sector should remain as it is, providing the services that is provided by them, but we must have another system where people who are spending out of pocket, we must have a national health insurance system where the people, everybody contributes a small amount of money, and then that system provides medications and other health care. And also what we have to do immediately is that because the expenditure, the price of medicines have gone up, people are coming into the state sector to take medicine more than previously. So, we must ensure there are a larger number of, larger quantity of medicines which are available in the health sector, should be available in the health sector, and that has to be ensured by the government.
Dr. Nihal, you mentioned taxation and specifically the effect that the income tax is having on medical professionals and basically making them leave the country. But tell me, has your party discussed this taxation not just for medical professionals but for the general public at large, this high, you can call it the pay tax, you can call it the income tax, this high taxation, are you all, if you do come into office, would you be reducing that high level of taxation? Because that may be one of the keys to keeping our doctors here and also other professionals.
Niresh, so when it comes to this, I mean, when this government is finding the solution for the economic crisis, I mean, they introduced this pay tax right? So then the most of the professionals now they are paying back this tax. So this came up during the crisis period. So they can't bear it. I mean, most of the professionals they are unable to bear it up at this moment. So definitely we have to discuss and see that whether we can reduce this the amount of the percentage that they are paying at the moment. Of course, people have to pay tax. I mean, there is no issue about it. But we believe that this is too much, because many of there can be other ways that we can discuss and see that where the government income can be increased. And especially if we really correct this the corruption issues and the mismanagement issues, perhaps that we can improve the government income. So therefore then we can think of actually reducing the tax that we are putting on the professionals. So then they might think twice to whether to really go abroad or stay in the country. So that's one way that we can try and keep the people who are leaving the country.
Let me ask you about the budget for the health sector. It's rather low in comparison to the national budget.
Yes.
And it's that seems to indicate that the government has given a very low priority. So it's a matter of priorities. I mean, if another ministry which is not as important as health
Yes.
is getting a much larger budget, and after all, what is more important than health? It affects everyone from infants right up to the time you pass away.
Yes.
So do you believe that there is a problem with prioritizing the health budget?
Yes, certainly. Actually, that as NPP, we think that health has to be a priority for the government, and it has to be when people have the right to have a proper health and health care. So that is where we are really we may be different from others. We think that the people have the right to have a good health service. So the government has to spend a reasonable amount of money for for providing the health services. So at the moment it's around 2%, I think, of the GDP. Perhaps that we might have to go at least for 5%, not immediately, but as to have a plan for that, and maybe within next 5 years to reach about at least 3% of the GDP for the health services. We should be able to really manage these crisis situations, and then make people get most of the people get the utilize the government health services.
Now, Dr. Ajith, you mentioned pharmaceuticals. Now we have had a crisis in the government pharmaceutical sector because of the human immunoglobulin scandal and other such scandals. The eye drop scandal, where people went blind because it was contaminated eye drops. I believe that is now before court. What's the situation now? Has the public got more faith in the pharmaceuticals from which are issued by the government? Because at one point it was quite a hysteria that people didn't trust the government for pharmaceuticals.
Yeah. So when it comes to pharmaceuticals, I think 90% of the healthcare budget is spent on pharmaceuticals. What we had during past 1 or 2 years is a very unusual situation where the NMRA, which is supposed to be an independent regulatory authority, was interfered by politicians. Actually, successive politicians during past 3 years, started during the COVID time, interfered with the process of drug regulation, drug registration. It was initially done with a tinge of patriotism, attempting to save deaths in that with that tinge. They were attempting to bring in certain vaccines for COVID. started from there and it became a real issue afterwards. So it came to a point where the entire process of drug registration was meddled with. 16 the pharmacists were attached to NMRA were transferred suddenly, and also the NMRA appointments of the director board was totally politicized. Politicians were directly involved in drug registration process, and we as a political party was vehemently opposing this right from the beginning, and you know the outcome of that. Now about 20 officers starting from the minister are being are remanded for this, and there is a hearing about this particular issue.
It's all before court
Right.
at the moment.
So actually afterwards I can see there is some confidence building by the current administration. I mean we must admit that recent times we have not heard any kind of controversy about a drug registration process. It is very simple. It is laid down in the NMRA Act how a drug has to be registered. If the procedures are adhered to, there is nothing much to do. So it's very simple. If the act is there, you implement the act and you work according to the rules, then the things will go smoothly. But what I see is not the quality of drugs that we face at the moment, the price of drugs. Price of drugs have actually tripled during last 3 years. As I said, 80% of the out-of-pocket budget of people are spent on purchasing medicine. So purchasing medicine has become a real issue because of the price of medicine. So you have to bring down the price of medicine. One way it can be done is attempting to manufacture whatever possible drugs in Sri Lanka at a low cost, and there are companies who are willing to do that. So what we have to do is encourage them and give them guidance as a government to manufacture drugs as much as possible in our country. Secondly, in the registration process and also in the purchasing process, government has to intervene and look at the checks and balances that they can make to ensure that exorbitant profits are not made out of drug trade. So that is also very important. So there are many things the government has to do to ensure that the people have enough drugs at a cheaper price with a better quality. So these are the things that government has to ensure.
Dr. Nihal, when it comes to the NMRA, which was supposed to be the guardian of pharmaceutical purchasers in this country, drugs plus pharmaceutical equipment, medical equipment, there seems to have been a total failure on the part of the NMRA and its officials. Of course, many have now been removed. How confident are you that the NMRA is back on an even keel, that they are now working as they should?
Niresh, now we can see that after some time of this crisis situation in the NMRA, now they have changed the administration to a certain extent, and perhaps that they are trying to improve the situation within the NMRA. But of course, we need to look at it, review it, what's going on, and then we have to see that what support the government can be given, and then perhaps that we might have to improve the essential drug list that the NMRA is using, and also that the procurement systems that the government is now using. So most of these issues have come up with the procurements right? So if we improve the procurement procedures, perhaps that we can really go for a longer term contract with the suppliers, and then also that we can look at the quality suppliers outside Sri Lanka, because 80% of drug is really imported. So unless we improve the procurement system, I mean, it will be really difficult for us to have a change what's going on. So we have to support, as the government, the government has to support NMRA to function independently and with the available structures, and then make sure that we monitor it for some time and see that what we need to do more in the future. So that's what we should be doing, and to improve the situations with the NMRA.
Now, Dr. Ajith, this whole crisis with pharmaceutical purchases, it drove home the point that you can't just allow politicians to rule over these key institutions, especially in the health sector. And now I'm honored to have you two gentlemen, both doctors, who are holding very high positions in your respective parties. Dr. Ajith, of course, in the URF as its chairman, and Dr. Nihal as the secretary of the NPP. Are we seeing a shift now of more professionals getting into, I wouldn't say getting into politics, but getting into governance?
See, I feel what we need is not only professionals coming into politics, introducing professionalism into politics. Now, we have seen professionals in politics since our independence, but what we lack, we are lacking now, maybe last few decades, is that there is no professionalism in these professionals, right? So there is no point, say for example, me getting into politics. Though I am a politician, if I don't behave professionally, if I don't conduct myself as a professional. So what is needed is that not only professionals come into politics, I feel that they should come into direct politics. So what we see now is that most of the professionals are advising, or they are thinking how the country should be changed, and they express themselves in social media and various places. What I feel is that will never change the country unless professionals come into direct politics, people's politics, local politics, and get into the institutions of political power. This country cannot be changed. It's not only the fact that the professionals should get into political powerhouses. In those houses, they should act professionally. Say for example, if you have a health minister who is a doctor, for example, he should conduct himself with this knowledge and allow the institution that has to be run independently to run independently, and get other professionals involved in that, rather than implementing his own opinions in the system. So that is what we need, is not the professionals in politics, but professionals who are behaving professionally in politics.
Dr. Nihal, what are your thoughts on this?
Yeah, it's more or less same, Niresh. That's how we started our activities in the National People's Power. Because originally I was not in direct politics, so then actually we got together, the professionals got together, and we created this National Intellectuals Organization. Actually, we who intervene in creating the National People's Power, at the beginning. So, and then most of our professionals are involved in policy making bodies within the party, and also they are also, perhaps that if we can set the government, after the next election. So most of our professionals who are already involved in the policy making activities in the party, they will involve in supporting the ministerial work, because they have had some experience experience in the past, who have been working in the different ministries, in the different, the profession as different professions. So this can help in running the ministries and supporting the whoever they become the minister in that, as a advisory in the advisory capacity. So that's how we are thinking, to make use of these professionals who have joined the NPP in the last 6 years, use them in running the country in the future if we really come to the power.
But we have seen professionals trying to get into politics, even in an advisory capacity. There was the famous Viat Maga a few years back, which seemed quite promising and quite powerful. But then after the election, the politicians simply brushed aside the professionals and simply took over. Is there a danger of that happening again, Dr. Nihal?
No, Niresh, I don't think that will happen with the National People's Power, because what happened in the past when the Viat Maga supporting that political party come to the power, it was the same set of people, who came to the power. And then they ran the government the way that they have been doing in the past. And then those professionals who supported them did not have a chance to really to associate in running the ministries in that particular government. So that's happened. So they were not a part of that whole business. That was the reason that Viat Maga did not make it the way that the country wanted.
Dr. Ajith, you said that you encourage professionals to enter politics and to behave professionally if they are elected. But do you feel that professionals are at a disadvantage when running a political campaign where their opponents are pure politicians, or even within their party, to obtain the nomination? Is that more difficult for a professional?
See, for a party which encourages professionals come into direct politics, not shadow politics. So this is what happened with Viat Maga. We had this Viat Maga organization full of professionals. They had thousands of professionals joining them. But what we saw was that when the political party which was affiliated with Viat Maga came into power, who sat in positions of power were not professionals. So what we as URF encourage is that don't do that. Come into direct politics, context elections like local elections, maybe district elections and provincial elections and even parliamentary elections. So that is what we encourage. We encourage and we nurture the professionals as politicians to become politicians, not the advisors to politicians. What we feel is that if the political party is not run by professionals, mere professionals having as medals of the political campaign, would ultimately what happen at the end is that they become disgusted with the political movement they are backing, and within 1 or 2 years they will leave en masse from that political organization. This is what happened with Viat Maga, and I feel any political party who is interested in bringing in professionalism into politics should do is that bringing in professionals into direct politics, not shadow politics.
Dr. Nihal, we are running out of time, unfortunately, but my final question to Dr. Nihal is, what about the local government elections, which we would think is a crucial factor in professionals entering politics, so that they can get a few years' experience before they go on to Parliament? Dr. Nihal, what is your party's policy with regard to the local government elections? How soon can we expect the local government elections after a general election?
Certainly, Niresh. I mean, this local government elections now has postponed forever, I think. This government did it because actually the minister postponed it from 1 year, and then last year this particular government, this current government, I mean, they have not said whether they are going to have the local government elections or not. So whatever the government come next, I mean, after the next presidential election, I am sure there will be, they will, whoever come to the power might dissolve the parliament, and then there will be a parliament election soon after that if a new candidate win the election. So then definitely after that there should be we should have the local government election, because for years now these local governments are without, the members, political members, yes.
And I'm afraid on that note we are out of time. My thanks indeed to Dr. Ajith Amarasinghe, Chairman of the United Republic Front, and Dr. Nihal Abeysinghe, Secretary of the National People's Power. Thank you very much for spending the time with us this evening. And to you at home, thank you very much for watching. The news is coming up next, so stay tuned and have a good evening.